It's funny you say that y'all got taken off. So for us, for instance, the past month, I was supposed to be on ultrasound and OB. Pretty much, my program is relatively small. There's probably about like 8 people per class. And all of our off-service rotations got canceled. Like some people were on trauma, some people were on just our electives, and our hospital activated disaster mode. Our program director was pretty much like, hey, everyone needs to work. It's changing right now because we're seeing a decrease in the volume. So we're kind of like not working as much right now, but as of last week, everyone in their whole program was working, except if you're sick.
Logistically for us, it's been interesting because it was kind of like a trickle effect where initially there weren't really many changes to our workload, but the whole hospital now has moved to a system where we're trying to prioritize people in their space of comfort. So we've been pulled off of our off-service rotations, as have our internal medicine colleagues been pulled out of the ED, and which has put a larger workload on us to kind of stretch our staffing of the department, requiring us to work more shifts and work a little often. The other thing that's happened is that we've started with like teleconsults, which has been really, really fascinating, where, our orthopedist and neurologist, no one's coming to the ED anymore. No consults physically come and see patients to the ED, which is quite interesting. But it allows for them to, I think I've seen our colleagues really give a lot more leeway in how they manage things with like, oh no, just like up the dose, like double it, we'll just see how it works. Like just trying to do what they can from afar. And the same thing I think is happening outside in the primary care setting, where people are calling their prime care doctors and they're just, oh, double the dose of your high blood pressure medication and your Lasix and your this and your that, because I don't want you to have to go into the hospital. So that part's been fascinating. And it's like my program director has been like, flexibility is the name of the game, and that's what we're all trying to do, is just stay as flexible.
So on a personal level, how has this affected you?
Ooh.
Janice?
Where do I begin? I guess the first thing, it hit me whenever my vacation, I was supposed to go to Europe next week with my significant other. Obviously that's not happening. But when this first happened, I was just like, no, we shouldn't cancel our ticket. Let's wait it out. And then I realized my vacation wasn't happening. So, being an intern, it's like you look forward to that vacation time. It's just like, and your dream, you work towards that vacation time. And that dream gets crushed, and it's like, oh, so that was the first blow. Second blow was when the really sick people started coming in, and I had to get used to seeing so much death. And I don't know if you guys have ever been in the New York emergency department, but they're not as luxurious as the ones down south at all. Like, you end up having, hospitals down south, they end up having stretchers in the hallway, of course, but in New York, they're like, sometimes they lack the resources we typically do down south, but I had to get used to people dying in places that wasn't originally meant for people who were really sick. I've had to get used to, like, as an ER physician, I went into it to kind of resuscitate people. I had to get used to not being able to resuscitate people. Like sometimes a patient will come in, and depending on the attending, they'll be like, we're just gonna, like, they'll come in cardiac arrest, respiratory arrest. Depending on the attending, they'll just say, we're gonna call the time of death at the ambulance bay. Like, we're not even gonna try, because there's a risk of spreading the virus whenever you perform CPR. Or you have like the people who had just died in the hallway, you can't start CPR. I remember there was one lady, I don't know, I think I was checking on another patient, and the nurse called me and she was like, hey, can you check this patient's pulse? I'm sorry, this is like really graphic for anyone who's watching. You can fast forward through this. So can you check this lady's pulse? And her body was still warm, and you could tell like she had just passed maybe within the past 10 minutes, and then you can't do anything about it. I had to get used to, if a patient needs to be intubated, if they're older, we've kind of just said, can't do anything. This is when we didn't have enough ventilators. Thankfully, that's been fixed. Like we have enough now, but when the first surge started, we didn't have enough ventilators, and there were just people who just couldn't get intubated because we didn't have enough vents. So I had to get used to like us choosing who gets to live and who gets to die. So it's been a huge moral dilemma in my head, because I didn't go into emergency medicine to like watch people die. I went into it to get that quick overturn, like, oh, you're feeling better, like, oh, we can treat you, but I feel helpless as a physician, So yeah, just thankfully in New York, there's been therapists that have been volunteering to like help physicians on the front line. I had to sign up for it because I was mentally just not okay. I was not in a good place, and it's been really helpful.
I would say like just the anxiety. I think this experience has definitely put my anxiety back on display in other cases where I've been able to like control it and tamp it down and all that. But I think from a lot of different perspectives, like from the patient perspective, from the humanity point of it, of, you know, acknowledging that, yes, we're, you know, it's a public health thing for us not to have visitors in the hospital, but people are dying alone. And that is like, you don't ever want to have to not only have that conversation with somebody, but to witness that and call the time. And, you know, when I was on my ICU rotation and have like a string of deaths in a row, it really does take a toll on you, even if you expect it, even if you don't know that person at all. But being their provider, it takes quite a heavy toll on you. And I think our providers are having to make some very just more morally challenging decisions based on what we're equipped with and what we can do and how we can protect ourselves as providers, which is just not the ideal situation. Like nobody is coming to play kind of like the be all end all and be the person that decides who lives and who doesn't. And, you know, definitely like where I'm at, we haven't reached that point yet, but we have instilled our protocols where, you know, these two attendings are going to agree that this is the case. And that's just going to be what it is, because we don't have family that are around and helping us make those decisions for the best, in the best way for the patient. So being super anxious around this situation, around being able to protect myself and my loved ones, and just kind of like just waiting to see how it plays out, I think has really, really been challenging for me, because now that I'm on vacation, like before, we all go to work every day. So it's like not really quarantine, like, you know, I'm just going to work. But now that I'm on vacation and like everything is closed and there is nothing that you can do to get relief from it. And I'm a homebody. I am a full-blown homebody. And even for me, it's been challenging to be like, okay, dang, do I need any groceries again? Because I just need somewhere to go. And now we're like one person per household can come into the grocery store. So you can't even really like make that a social event. Like, I don't know. It's been a very difficult, I think, thing to experience while we're all trying to cope with it and be flexible with it. It's just, you know, I just try to emphasize it. It's just not normal. That's the thing that I think I want to make sure that we put across. Like, what we're doing right now is not normal, and it's okay to acknowledge that it's not normal.
Mm-hmm.
I totally agree. Some days, oh no, go ahead.
I was just going to piggyback off of what Suzette said. The anxiety going into work is very real, especially when you're told by hospital, when there was no PPE, we were being offered trash bags. Like, can you imagine that? Like, you're going into war pretty much, and you're being offered trash bags. And it's just like, it's like, how do you guys expect me to do my job if I'm not being protected the way I should be? So then you go home, you're worrying if you're going to pick it up and give it to one of your friends or one of your family members. And I agree, the anxiety component is very real.
Yeah. And I'll piggyback on what you said when you said this is not normal. There are some days where I wake up and I'm like, is this real? Is this really happening?
Yeah.
Do we really have this funky virus going around so much so that people can't get out of their house, and going to work as a, you know, young person is unsafe, and all these things? I mean, it's a drastic change, and, you know, how it affects us personally. I think, you know, piggybacking on what both of them were saying, that, yeah, like vacation, you know, simple things like going to the grocery store or being comfortable around coming home with roommates or family or friends around you. And then for me, as I mentioned earlier, you know, being taken out of work entirely, even though I am a physician and, you know, this is what I signed up for, but, you know, I was told that it's not safe, and that's probably true. But it some days just doesn't even feel like it's real.
Yeah. I think for me, the feelings that I have about the situation, you know, is less anxiety, more so because, you know, I haven't had the opportunity to kind of be thrown into, I guess, the mass of COVID patients. My feelings are more so guilt, feeling like, you know, this is what we all signed up to do this. We've all signed up to be physicians and take care of patients regardless of the situation. And right now, not being able to, in a way, feeling like I'm having too much time off, because time off is great in residency, especially in your first year where you're working so hard and, you know, you feel good about it. But when you have so much time off without feeling like you've earned it, it's just a lot of guilt that I feel like I want to do more. I need to do more, but then at the same time, I can't at the moment. So that's more so like what I'm feeling is like more guilt than anything else.
I've been getting excited when I see like a non-respiratory complaint, like, oh my gosh, let me go see this kidney stone. Like, I'm so excited about it. Because, you know, that's, you know what you signed up for, you know, as a physician. And when we are so derailed from what that experience is supposed to look like, it's kind of like, man, what is happening? Like, is this even happening? Like,
yeah. I was on a virtual consults this week. I'm doing infectious diseases from home. And it's strange not being able to see when you're getting consulted for an abscess or an infected ulcer or something, and not even seeing it, or seeing it in a picture. It's definitely different, but it just has to work. Like you said, people are making recommendations via teleconsults from the ED and rolling with what can work right now and what's the most safe thing to do. Yeah. I think it may change how we practice medicine a little later.
Yes.
That change might be slow to come, but it'll come. Yeah. There'll be differences for sure.
I feel like the telemedicine is going to play a really significant role later down the line. And so maybe that is one of the silver linings, like with this entire thing regarding like healthcare.
Yeah, I haven't even told you guys the darkest of stories out of protection from anyone watching this. But yeah.
I've seen some stuff of recordings of the emergency rooms, like on the news. It looks like it's a war zone.
No, it's bad. It's pretty bad. Like just the stretches in the halls, and I don't know. It's just I don't know if you guys want to hear. This is probably the darkest thing I did last week or within this whole thing. It was just like there was a patient coming in. He was really hypotensive, crashing, of course, and we had to make space for them, and of course the ED is full. And then someone says, okay, we need to move some of the dead bodies around because at the moment, our morgue is full. So they've been storing, what you've been hearing on the news is accurate. Like they've been storing the bodies in freezer trucks outside the hospital. Our morgue is full. So sometimes the bodies just sit in the ED for hours at a time when they shouldn't. So I had to make room for a patient that was coming in that was crashing. And this is probably the darkest thing I've ever done in my life. Had to move a stretcher of a patient. It had a dead body in it. Had to move it to another room with another dead body. And then we just piled the dead bodies in the corner to make room for a patient that was crashing. So that, it's been pretty bad. Yeah, it's just like, okay. Yeah. This is, yeah.
And it sounds so inhuman, but that's the only thing you can do if you're out of room. And that's, you have to act quickly, right? And
it's just like, I can't believe I just did that. Yeah. I'm not okay with this,
Yeah.
But I'll make it through. I feel like I'm very anxious to see how all of us are going to be affected by this in the long term. Like, are we still going to be wearing PPE year-round because you have patients who may have picked the COVID up again? Like, let's say in July, August, when all this is over, and then you're exposed. Like, are we going to be just wearing PPE year-round? I don't know. Just really anxious to see, and the mental effect it's going to have on a lot of us, especially where it's really bad. Like, are we going to see our specialties differently now? I can say that one of the silver linings out of this, I can say it's made me stronger as a physician. I'm kind of a lot more assertive with things now because I'm just seeing so many sick people at one time now versus me seeing like, oh, you have a finger cut, like, oh, you have a boil on your armpit that can't be drained, like, okay, So it's made me stronger. But I want to see how it affects us in the long term.
Yeah. Like, I'm interested because, when people think about PTSD, they think about, soldiers who were in Iraq or anything like that. Now I'm wondering, like, what's the population of physicians who will be suffering from PTSD?
Right.
So that's another interesting part about this entire thing.
Yeah.
I also think even more personal stuff like shaking hands, just going out to the grocery store, very casual things, going to a basketball game, going out to a restaurant and having a meal, whatever it may be, going to a friend's house for dinner with a group of friends, small things like that. When are those going to happen again? Or will we ever do those things normally,